We talk about why we do what we do. The hours are crazy, the lifestyle's crazy, but Ryan's case is why we do what we do.
The day was Sunday, February 15, 2015, and I was doing a community service event with my church, the Church of Hope. Later that day, after the volunteer work, I met a friend at the Wing House for dinner, and he showed up on a motorcycle, and I was excited. I took it for a spin. Somebody pulled out in front of me, and my body was thrown a city block.
He enjoyed being on his motorcycle, was doing what he had done many times before, didn't ever think about it, and there he was. He'd been in a severe motorcycle accident, came in as what we call a trauma alert, which is the highest level of trauma activation. The whole team shows up. And his wife came in soon after we had received him to the trauma bay. He was intubated, he was in the operating room, fighting for his life, had brain injuries, skeletal injuries, didn't know if he was gonna make it through the night. When I had the opportunity to speak with his wife, first I had to reassure her, look, he's alive, that's number one. Here's what's happened, here's what we're doing. A lot of folks knew about the leg injury, and they said, are you gonna be able to save the leg? And I said, I don't even know if we're gonna be able to save his life.
I had this peace that God was going to heal my husband, and he was going to heal him through the hands of these excellent doctors.
I went into this job to be there for those people at that time. So that's what I've been preparing for my whole life. That's what we've been preparing for our whole lives as surgeons. And that's what this team has been preparing for since day one when the trauma center opened.
He was in the hospital for 39 days. We didn't know if he was going to live from one day to the next. We didn't know. Ryan's lungs were failing, and that was the big problem, even with his other injuries. Basically, the respiratory therapists were like, we don't know what else to do. So Dr. Ferrer comes around and he's like, okay, I know what I'm gonna do. And I remember word for word, he said, I was holding my newborn baby in one hand and reading how to save Ryan's lungs in the other hand. And I looked at him and I just knew, I'm like, oh my gosh, I'm so blessed that he is our surgeon, that he cares for Ryan when he is holding his baby and he's thinking about my husband. I know that those doctors, they care about their patients, they care about their future. He knew that Ryan didn't have the time to sit and wait.
We knew after about 20 days or so that he was gonna make it, he was gonna live. But you really didn't know what his function was going to be like. It was very difficult. And it wasn't until many weeks after, I would say almost months after, that you knew that he was going to be fairly functional. And that's a credit to Ryan. And that's what makes Ryan's story so inspirational, is Ryan and his family.
I don't have a lot of memories of my time at Ocala Regional, but the ones I do have are very good memories of loving, caring people who took really good care of me and made me feel safe and comforted. After I was released from the hospital, I was at home for a few months, and I just got a prosthetic leg, and I was up and walking around, and I wanted to go back to the hospital to see all the people that saved me and helped me and tell them thank you for all their hard work.
I think the moment in time that really sticks out to me is when he came back to the ICU, because it was like a scene from a movie. He entered in that hallway, stood there for a moment, and it was like you were seeing something and you didn't believe it. You kind of had to blink. Is that Ryan? Yeah, that's Ryan. Hey. And then it was like a movie. Somebody taps somebody else, and there's people literally a couple people coming to the hallway and a couple more. And I think at that moment people were saying, wow, this is why we do what we do. We are making a difference.
I am so happy and so thrilled that I can still live pretty much the same life as I always lived. There's not a whole lot different. I did lose a leg. I do have substantial nerve damage in my right arm. But in general, my life is still pretty much the same.
He's raising his kids, he's back to work, and it's just so inspiring, because there's a whole population of survivors out there that need to hear there's life after this. Look, I'm an example. One of the big reasons why Ryan survived is he got here quick. Had he had a long ways to go, he may not have survived.
And I'm just so thankful that the trauma center was so close to us, because I truly believe if Ryan had to go to another hospital out of town, that he wouldn't have made it. He was moments away, I believe, from dying.
When I think about what this trauma center means to this area, I think about stories like Ryan, and I think about the fact that, again, I would never wish tragedy on anybody. I would never wish injury on anybody, but we all know it's an inevitable part of life. And to have people here that have your back, I know it's got to be a good feeling. I know it is for the people that have survived, and that makes me feel good to be part of saving somebody's life and having that person come back like Ryan did, and we've had that over and over again. Thank you for being there. Thank you for being ready to be the people that are there when all hell breaks loose. When the tragedy strikes, it's nice to know there's somebody that's going to be there.